6.5 million people in the U.S. are currently affected by the silent epidemic, which are chronic wounds that are slow to heal. According to the U.S. National Institute of Health, that number is likely to rise. Every day as a wound care nurse on the medical surgical unit of the hospital here at Vidant Medical Center, I encounter various and numerous of patients that require urgent medical attention. When we encounter patients with chronic wounds, our number one goal is to heal the patient with less pain and as soon as possible. I was recently chosen to work on a committee comprised of nurses from several different units to determine what products are the most beneficial to wound healing for patients we are encountering and treating. We started reviewing wound cases that we encountered here in the hospital. After reviewing each wound patient's medical histories, it turns out that obesity and/or diabetes affected more than half of our patients. A wound on a diabetic or obese patient can be life-threatening for the patient if not treated in a proper and timely manner. Wounds present themselves in many different shapes and sizes. This is a roadmap for us to choose the proper treatments and precaution plan for the patients. While being cost-effective, I want this hospital, along with this amazing staff, to be a part of history in the making for being known as the #1 wound care facility. I wanted to get to the root to fix the problem with wound care. I had the privilege of shadowing Miss Renee Price, RN, a Vidant wound care nurse specialist. One of the first words out of her mouth was oxygen. She reminded me that oxygen creates more red blood cells, which helps to heal wounds. Currently at Vidant, we only have one option to heal any wounds we encounter. Currently, we are only using Duraderm. With this silent epidemic that is still growing, the committee and I agree we need additional treatment and products to help heal our patients here in the medical surgical unit. This one product is not effective for the wound cases that we are encountering. As a solution to our dilemma, I propose investing into 2 more products that will help in being an effective cure of any wounds, no matter the size or depth. This proposal provides you with products, solutions, and the cost of investing. Here are the details about the dilemma we are faced with daily. The problem: Vidant Medical Center is facing a silent epidemic without the proper methods to cure it. Here at Vidant Medical Center, there is only one treatment option, which is Duraderm. The Duraderm is a moist dressing that is used to cover surface type wounds. Thousands of people are subject to wounds because of obesity and diabetes. These comorbidities cause patients with a wound a longer, more expensive treatment and healing time. This puts our staff and entire hospital in jeopardy for not being able to control and cure this epidemic. Here are a few reasons why. According to registered nurse Renee Price at Vidant Wound Care Facility, she stated, "We can give patients the treatments, but if they do not have a healthy diet, all treatments will have a negative reaction to the unhealthy diet." According to registered nurse Kiara Byrd, a wound care nurse supervisor for home health and hospice, states, "A diabetic wound is 10 times harder to heal than a patient without it." According to MS, RN, APN, CDE, Kathy Olahan, a NP and certified diabetes direct educator in the internal medicine department, states, in the American Journal of Nurses, knowing a wound care patient's level of glycemic control can inform post-operative care and improve healing and discharge planning. The solution: while shadowing registered nurse Renee Price, I was introduced to 3 new innovative products for wound care. These products can only be used if a patient is being treated at a wound care center. The committee of nurses and myself strongly believe we need these innovative products in order to control and heal the number of patients we are treating daily. Listed below are new and innovative treatments that our medical/surgical unit could use tremendously. First, there's SNAP therapy. This is for patients who have small and low extenuating wounds with disposable NPWT. Absorptive hydrocolloid properties help to maintain a seal in the presence of sweat to help reduce peri-wound macretion. SNAP therapy system is a completely flat, comfortable dressing surface to help minimize further pressure damage. Integrated microport enables flexibility and tight bending radius for wounds located in difficult areas, cut to the lymph tubing, and integrated one-way flow for improved safety. Next, we have coated sorbac. Our dressings or gauze used to treat wounds. Coated sorbac hydroactive B is used for burns or any dry wounds. This is a moist dressing that is designed to keep the wound damp while healing it. Coated sorbac is used for wounds that are not wet. This dressing has bacteria binding foam dressing with super absorbers and silicone border. Coated sorbac is a bacteria binding ribbon gauze used to pack holes or tunneling wounds. All coated sorbac treatments are left on the wound for a week or until the dressing is saturated around the edges, close to the skin area. Hyperbaric oxygen chamber is a chamber that the patients are placed into, immersed in 100% oxygen at a rate that is above normal. All wounds need oxygen to heal properly. It is a well-known fact that exposing a wound to oxygen speeds up the healing process. The goal of this treatment is to fill the blood with enough oxygen to repair tissues and restore normal body function. It helps the wound to heal by bringing oxygen-rich plasma to tissue starved for oxygen, prevents reperfusion injury, helps block the action of harmful bacteria, and strengthens the body's immune system, encourages the formation of new collagen and new skin cells. The patient is placed in a monoplace chamber that is built for one person. It is a long plastic tube that resembles an MRI machine. We slide the patient into the chamber to relax, lie down, sleep, or watch television comfortably while taking deep breaths. This chamber slowly starts to fill with oxygen, 2.5 times the normal air pressure. This treatment session can last up to 2 hours. Even if our patients are already using SNAP treatment or Coated sorbac, they are still able to receive hyperbaric oxygen. We would remove the treatment and place the patient in the chamber. Once patient is finished, we will place the treatment back on the patient. The current treatment of durdurum that we are using at Vital Medical Center is not effective enough for the types of wounds we are encountering. By not being able to control this stylic epidemic, we are putting our patients at risk for longer healing time, gangrene, amputations, increased cost, suffering, and could result in the patient's demise. It also puts the hospital and its staff at a risk of negligence due to a lack of proper care for our patients. Based on the observations of the innovative products for wound care, the committee decided that Coated sorbac and the hyperbaric oxygen chamber would be a great investment to healing our patients' wounds. To invest in Coated sorbac, the cost will be $27 per gauze or dressing. This is then charged to the patient for 3 times that amount. It is proved that this treatment is very profitable treatment. The hyperbaric oxygen chamber is an investment of $1 million. The charge for the treatment is $4,000 a month. Per patient, with the number of patients we are treating, we will be able to be out of debt within 6 months of treating the patients. If we choose to use these new products, we will be able to stop this silent epidemic in its tracks and create a healthier life for our patients. It would give nurses a sense of relief knowing we can fight this epidemic. I look forward to hearing from you about this proposal. If you have any questions or concerns, I will stop by your office next Monday to address them. Thank you.